Hey, are you suffering from a bulge or herniated disc? Have you been diagnosed with spinal stenosis or degenerative disc disease? 75 to 85% of Americans will experience back pain episodes at least once in their lifetime. The annual cost of back pain treatment in America is almost toppling $250 billion a year. The majority of these disc and spinal related problems come from injuries such as motor vehicle accidents, work-related injuries, sports injuries, sedentary lifestyles, and lack of exercise. If you're suffering, we may have the answer for you with our IDD therapy. Are you unable to work? Are you not able to stand and sit comfortably? Have you lost the ability to tie your shoes or put your socks on in the morning? Do you have a hard time getting out of bed? Have you been making poor nutrition choices? How about you're not very enthused about exercising? You've lost enjoyment of life. You can't play with your kids. You can't walk your dog. You can't do the things you like to do, like walk or golf or play volleyball or go to the beach. Are you suffering with numbness, tingling, leg pain, sciatic pain, even shoulder pain? Hands are tingly and numb, maybe even got loss of weakness. In severe cases, bowel and bladder trouble could arise. These are conditions that may result from having disc-related issues in your spine. Let me tell you about my story. When I was 9 years old, I fell off the back of a three-wheeler. It knocked the wind out of me. I couldn't stand up the next day. My parents took me to a doctor who helped me get back on my feet. And then through high school, I played football, I did sports, and when I went into college, I started weightlifting and bodybuilding. And I hurt my low back doing deadlifts to the point where I couldn't walk again. I went to a chiropractor and he fixed me up. No problem. Until I started having children many years later, I lifted my 3-year-old daughter onto the toilet and kapow, my back went out on me. I couldn't walk. I couldn't move. I was in severe pain and agony. I laid in bed for 3 days. I couldn't put my shoes on. I couldn't get dressed. I couldn't go to work. I tried everything. I tried traditional chiropractic. I did massage. I did acupuncture. I did hot and cold. I even did over-the-counter medications. And just short from doing surgery, a friend of mine said, hey, you should try spinal decompression. I recommend you get an MRI. We had an MRI done. They found 3 bulges in my back and 2 annular tears from lifting my daughter onto the toilet. And that's how I got introduced to spinal decompression. After my first decompression treatment, I was super scared. I was very nervous to get on and off the table. But it was really interesting. After my first session, the doctor lifted me up off the table. I thought to myself, with all the stuff that I've tried and nothing had worked, I thought to myself, I'm feeling relief. I think this thing's gonna work. And so I stuck with it. I followed the doctor's recommendations, followed his treatment protocol, and within just a few months, I was 100%. The chronic pain that I had in my low back when I rolled in bed and got up in the morning was no longer there. The debilitating pain where I couldn't go and mow the lawn or do yard work or do things with my family was gone. And I got my life back by spinal decompression. And so now I go every month or 2 just for a preventative checkup, just to make sure that I'm controlling and containing the disc problem that I had resolved through spinal decompression. I was so excited about the results of spinal decompression, I started to study it myself. We had many patients in our clinic who wouldn't resolve with traditional care, with massage, with chiropractic, with exercise. I became so involved, I got triple certified in spinal decompression through University of Parker in Dallas, Texas, and National University in Lombard, Illinois. I also went to the master certification class in spinal decompression in Decatur, Illinois. Our team is certified through North American Medical Association in IDD therapy, intervertebral differential dynamics. We are so excited with this technology. We do a thorough screening. Many patients are scared because they've been told, hey, I have to have shots, or they've done shots and they didn't work, or they've been told that surgery is their only option. And I'm here to tell you there are other options. Success rate with spinal decompression is anywhere from 88 to 92% successful for relieving back pain if you're a qualified candidate. We have our patients go through a screening process to determine if their condition is right for IDD therapy, for a natural approach. You know, many of our patients think that they have limited options when it comes to back pain treatment. We have seen so many patients who've been told to use the medication, to have the shots, to have surgery. And we're here to tell you that you have another option. Many patients assume since they don't have insurance, they can't afford non-surgical spinal decompression. We have care plans that make care affordable for people. We also have agreements with different MRI facilities to make MRIs affordable. People no longer use medications that were once told, hey, you're going to have to be on these medications the rest of your life, or you're going to have surgery. We see a lot of people who have had failed back surgery come in and get great results if they qualify. We'd like to say that the sooner you get in, the better. That's one of the common mistakes a lot of people make, is they wait too long. And the longer you wait, the harder it is to correct the disc problem. Our whole treatment protocol is gentle. These machines behind me are designed to help milk the disc, to bring nutrients back into the disc, to bring blood into the disc, to remove waste, and actually create a negative vacuum in the disc. So if there's a bulge or herniation, it actually helps to reabsorb the herniation, the bulge, back into the disc, which takes pressure off the nerves, which helps people feel better. You know, many patients think that our conservative approach is going to be painful. It's going to be a rough experience. And I'm here to tell you firsthand, my first treatment, I was scared to death. And when I got off that table, I felt relief instantly. And I knew I was going to get better. And I was so excited to have a non-surgical, non-medicated approach to helping correct my spine problems. You know, many consumers think that surgery will save them time and it'll save them money. And the truth is a little bit different than that. The cost of rehab, the cost of missing work, the cost of surgery can cost people tens of thousands of dollars in lost wages and out-of-pocket expenses, even with insurance. I always tell people, don't delay, come in, let's do a consultation, let's review your MRI to determine if non-surgical spinal decompression is right for you. We are so excited to bring this treatment to Vancouver, Washington. This is why we're offering an initial disc evaluation assessment for the first 7 people who see this video for only $19. What are we going to do during that procedure? We are going to look at an MRI that you've had at another facility. We're going to read it together. We're going to go over the findings. We're going to explain how spinal decompression may be able to help you. We're going to do an evaluation to determine if you're a qualified candidate to receive this therapy. Anywhere from 88 to 92% of the people that receive non-surgical spinal decompression get great to excellent results. And we're here to help people achieve a higher level of health, to get their function back without medications, without surgery, so that they can get the quality of life that they deserve. The biggest thing that we have found is don't delay. The sooner you get in for an evaluation consultation, the better. I want to thank you for watching. Call us here at the Vancouver Disc Center, 360-787-0787.
Disc Centers of America, a call to us can change your life.